Body is trying to tell you something important. Today we're going to uncover the early signs of cancer you shouldn't ignore. Our health is something we all hold dear. Our bodies are incredible machines, constantly working to keep us alive and healthy. But sometimes they try to warn us about something serious, something we should never ignore. Cancer is one of the leading causes of death worldwide, and early detection can make all the difference. Many early cancer symptoms mimic minor, everyday health issues, making them easy to overlook. This video breaks down 14 potential early warning signs of cancer that should never be ignored. Let's dive in. Alright, let's talk about weight loss. Now I know what you're thinking. Dr. Mike, losing weight is a good thing, right? And you're right, it can be, especially if you've been working hard at it. But what I want to talk about today is unexplained weight loss. You haven't changed your diet, you haven't suddenly become a gym rat, but the pounds are just melting off. We're talking about significant weight loss. Think 10 pounds or more seemingly out of nowhere. This kind of unexplained weight loss could be a sign of something more serious going on inside, potentially even cancers of the stomach, pancreas, esophagus, or lung. Cancer can affect your metabolism, causing your body to burn calories much faster than it normally would. If you notice the number on the scale dropping dramatically and you can't figure out why, it's crucial to get yourself checked out by a doctor. Let's be real, we live in a society that glorifies the hustle, the go, go, go mentality. But there's a difference between regular everyday tiredness and the kind of fatigue we're talking about today, persistent fatigue. This isn't just about needing an extra cup of coffee in the morning. This is about feeling completely drained, wiped out, no matter how much sleep you get. Cancer-related fatigue is different from your average tiredness. Cancers like leukemia, as well as colon and stomach cancers, can really mess with your body's ability to produce red blood cells, which are responsible for carrying oxygen throughout your body. If you're constantly feeling exhausted, like you're dragging yourself through the day, don't just brush it off as being overworked. It's crucial to listen to your body and get it checked out. Pain is our body's way of telling us something's wrong, right? It's a signal that we need to pay attention. But what happens when the pain lingers, when there's no obvious reason for it? That's what we call unexplained pain, and it's definitely something you shouldn't ignore. We're talking about persistent, chronic pain that just won't quit. This kind of pain can be a sign of something more serious lurking beneath the surface, potentially even cancer. For instance, bone cancer and testicular cancer often manifest as localized pain in those specific areas, and those nagging, persistent headaches that just won't seem to go away. They could be a sign of a brain tumor, especially if they're accompanied by other symptoms like nausea or vision changes. Cancer-related pain can be sneaky. It shouldn't be ignored. Chapter 4. Skin changes. Your skin can actually be a window into your overall health. Sometimes changes in your skin can be a warning sign of something more serious like cancer. Noticeable, persistent changes in the color, texture, or appearance of your skin can be significant. For example, hyperpigmentation, jaundice, or new or changing moles could be signs of skin cancer or other serious conditions. It's crucial to get them checked out by a dermatologist as soon as possible. Chapter 5. Persistent cough or hoarseness. A persistent cough that just won't quit, especially one that's accompanied by other symptoms like blood, could be a sign of something more serious like lung cancer or throat cancer. Even people who have never smoked can develop lung cancer. If a cough lasts for more than a few weeks, or if it's accompanied by blood or phlegm, chest pain, shortness of breath, or unexplained weight loss, see a doctor. It's always better to be safe. Chapter 6. Changes in bowel habits. Persistent changes in your bowel habits could be a sign of something more serious going on in your digestive system, potentially even colorectal cancer. Blood in the stool is a major red flag and should never be ignored. Persistent diarrhea or constipation, especially if it's accompanied by abdominal pain or cramping, is also something to pay attention to. Unusual stool color or shape or a feeling of incomplete bowel movements are also signs. These symptoms could be caused by other conditions, but it's always best to err on the side of caution. Get checked out by a doctor just to be safe. Chapter 7. Difficulty swallowing. When difficulty swallowing becomes persistent, it's called dysphagia, and it could be a sign of something more serious going on in your throat or esophagus, potentially even esophageal cancer, throat cancer, or stomach cancer. Dysphagia is a persistent feeling that food is getting stuck in your throat, or a feeling like there's a lump in your throat that just won't go away. This sensation can be really uncomfortable and even painful, and it can make it difficult to eat a proper meal. If you're experiencing persistent difficulty swallowing, it's essential to see your doctor. Rule out any serious underlying conditions. Chapter 8. Unusual bleeding. Anytime you experience unusual bleeding, it's a sign that something's not quite right, and it's crucial to get it checked out by a medical professional. Blood in your urine, also known as hematuria, is a big red flag and could be a sign of bladder cancer or kidney cancer. Blood in your stool can be a sign of colorectal cancer. Vaginal bleeding outside of your regular menstrual cycle could indicate cervical cancer or endometrial cancer. Coughing up blood or hemoptysis is a serious symptom that should never be ignored, as it could be a sign of lung cancer. Chapter 9. Lumps or swelling. Sometimes a new lump or swelling, especially one that doesn't go away or that grows larger over time, can be a sign of something more serious, like cancer. Breast lumps are a common symptom of breast cancer, but lumps can appear anywhere in the body, including the testicles, neck, armpits, and other areas where lymph nodes are located. Any new lump or swelling that you can feel under your skin is worth getting checked out by a doctor. Pay attention to the size, shape, and texture of the lump and whether it's painful or tender to the touch. Early detection is key. Chapter 10. Frequent infections or fevers. When infections become frequent or persistent, it could be a sign of something more serious going on, like cancer. Blood cancers such as leukemia and lymphoma can wreak havoc on your immune system, leaving you vulnerable to all sorts of infections. If you find yourself getting sick more often than usual, experiencing frequent fevers, or taking longer than normal to recover from illnesses, talk to your doctor. Your immune system might be compromised. Chapter 11. Persistent indigestion or heartburn. When symptoms become chronic, it could be a sign of something more serious brewing in your digestive system, potentially even stomach cancer or esophageal cancer. Persistent indigestion or heartburn that just won't quit no matter what you do is a concern. This type of chronic indigestion is often accompanied by other symptoms such as nausea, vomiting, a feeling of fullness, even after eating small amounts, or difficulty swallowing. If you're experiencing any of these symptoms, see your doctor. Urination. It's something we don't often talk about, but it's a vital bodily function that can tell us a lot about our health. When bathroom habits change, it could be a sign of something more serious going on, potentially even bladder cancer, kidney cancer, or prostate cancer. Blood in the urine, increased urgency or frequency of urination, especially at night, and pain or burning during urination are symptoms that warrant attention. Always consult a doctor. Bloating, it's a common complaint, especially among women. Persistent bloating, especially when accompanied by other symptoms, could be a sign of something more serious like ovarian cancer, stomach cancer, or pancreatic cancer. Persistent bloating that lasts for weeks or even months, often accompanied by other symptoms like abdominal pain, changes in appetite, or a feeling of fullness even after eating small amounts, is a concern. See your doctor to rule out any serious underlying conditions. Our skin is pretty resilient, and most minor cuts and scrapes heal up nicely on their own. But when a sore refuses to heal, or it heals and then comes back, it could be a sign of something more serious going on, potentially even skin cancer or oral cancer. Persistent sores that just won't go away, or sores that heal and then reappear in the same spot, are concerning. Pay close attention to sores in areas that are frequently exposed to the sun, like the face, ears, neck, lips, and hands. If you notice any sores in your mouth that don't heal within a couple of weeks, see your dentist or doctor right away. We've covered a lot of ground today, and I know it can be overwhelming to think about all the potential warning signs of cancer. The goal here isn't to scare you, it's to empower you to take control of your health. While these symptoms don't always mean cancer, they are not normal and should never be ignored. Early detection saves lives. If you or someone you know is experiencing persistent, unexplained symptoms, consult a healthcare professional as soon as possible. Be proactive. Be your own health advocate and get those checkups. Until next time, stay happy and healthy.